In year 2000, United Nations set a 15-year development target for developing nations known as Millennium Development Goals, MDGs. In Nigeria, the federal government set up MDGs offices in the various states of the country. Ekiti MDGs office became the representative office of the southwestern part of the country. The vision of Ekiti MDGs incidentally keys with the 8-point agenda of Dr. Kayode Fayemi-led administration, with an arrowhead of reducing poverty in the state. Ekiti MDGs office is headed by Mrs. Bumi Dipo Salami, the special advisor to Governor Fayemi on MDGs end plan.
Within our Ekiti land of honor, that we are just about 2.4 million people at the most. If that can happen for us, even if the scorecard says Nigeria is not on track, but Ekiti people will know that our governor has made sure that in this state we are on track. In this state there will be poverty, it will be sent out of the land, that our people will have good lives, that the well-being of the people will be prioritized, which is why he has developed and devised strategies to ensure that happens. When people see him coming up with this strategy, this program, that activity, they may not know why, because they might even see those ones as standalone strategies. But there is no standalone strategy in this administration. Each strategy feeds into the other. Okay, when you look at the social security, for instance, when you have elderly people 65 and above who have access to 5,000 naira a day, that is about 200 naira, 5,000 naira a month. That is about 200 naira a day, which is like the minimum requirement for getting just above the poverty line. And then that means the elderly person that beneficiary can feed. And then he has free health program. He has a free health program for the same category of people. It means from that 5,000 naira, they don't have to start paying for healthcare. That also feeds into another MDG goal. Okay? And then you have children that have access to schooling, free primary, free education up to secondary school level. It means that if such a beneficiary still has young children, such a beneficiary doesn't still have to stress himself or herself to pay for education. Okay, so you see how all of them just roll. And then provision of water, which will help the hygiene, which means that the healthcare of the people, will be, their health status will be improved. So when you look at all the strategies, even the road construction, the road infrastructure is not standalone. Because if you have people for people to move with ease of access from one point to the other. There is free health for pregnant women, but that pregnant woman also has a good road linking her house to the health center, which means that life is easier for that pregnant woman, which means that for us in Ekiti, meeting the MDGs will be easier than in some other places that there is no holistic package for ensuring that the lives of the people get better.
Explaining government's concern on critical needs such as maternal health, Dr. Hadi Fayemi sheds light on the state's resolve to stem deaths associated with child delivery.
The reason why we offer free health care to pregnant women is that we find the level of women who died whilst giving life to be totally unacceptable. No one should die in the process of giving life. And in most cases, these are entirely avoidable losses. If we take steps that are preventive, that are standard in most societies, there's no question that we will lose fewer people. And my own vision is that we don't even lose anyone to death whilst giving life. And this is what is responsible for our Abiro program, because we feel that children must live and their mothers must not die as well. So everything that we do in our free health program and our free health missions have pointed in the direction of ensuring that our primary health care centers are in a position to feed our general and tertiary institutions, even in cases that become impossible for them to handle. And we're making this as proximate to our communities as possible. Any community that has 5,000 people has a primary health center in Ekiti. We have 293 of them, and we're only about 132 communities in the entire state. But for us, it is absolutely imperative that we make sure that we have primary health care centers in every community, and that these primary health care centers have adequate staff.
The performance of the state has been said to be commendable, especially compared to other states in the Federation. But how does the government work to ensure the reality of making poverty history in Ekiti State?
Cutting into half the number of poor people. That's the first target in Ekiti State, in the nation, in the whole world. Cutting by half. But for us, it's even beyond that, because I will say Ekiti will surpass the targets, because when you add the figures of the different beneficiaries from the different interventions, you will see that we will barely have extremely poor people in Ekiti by the time all the efforts begin to yield fruit. Because we all know that Ekiti is a civil service state. So we have the figure out of Ekiti people who are resident in Ekiti that are on the payroll of government. Those ones are not that they can be categorized amongst the extremely poor people. Then you have the beneficiaries of the Social Security, about 20,000. You have beneficiaries of the Youth in Agriculture program. And not only that, in the agriculture sector, there are also some other initiatives trying to revive our cocoa plantations, trying to revive so many things, trying to have the value chain, the full value chain, agriculture value chain for some of our crops. That's where you have, collaboration with some organizations, PPP arrangements to ensure that, for instance, we have the full value chain for cocoa, for cassava, for instance. And there are farmers in those different areas, people who are regions that are focused on, some particular crops. And then you have the companies that are coming into town to help us with processing, and not only with processing, with marketing. By the time you have, all those companies, when they employ people, it means there will be poverty taken out of those families. We have our conditional cash transfer program of NDGs that will be, that will empower 2,250 Ekiti women. Give them 5,000 naira per month, and then at the end of 1 year, give them 100,000 to start an agri-related venture. Which means in those families as well, extreme poverty will become a thing of the past. Okay, and you have so many recruitments going on, you have so many intervention programs, you have so many strategies in different sectors that will enable our people have access to the basic, the minimum that will enable them feed. And because you also have other programs in other areas that would help them save or conserve whatever they are getting. If for instance you have the transport system that's been improved, that's been subsidized, you have and others. So when you now look at all the interventions, the totality of the interventions, you'll see that. And then trying to restore values of hard work, values of dedication, of commitment, letting young people, trying to reorient young people to value themselves and to see what they can also contribute to the state.
The combination of various components of the 8 Millennium Goals as interpreted in the Ekiti government's 8-point agenda has seamlessly helped in development and delivering on the other MDGs. Focusing closely on some of the interventions of the government that has translated to dividend, Mrs. Bumi Depo Salami was passionate in explaining few progressive efforts which differentiates between the Dr. Kadi Fayemi-led administration and successive governments.
By 2015, we should have our water infrastructure should have improved. The access of the people to water should have improved, which is why for Governor Fayemi in his executive development strategy for between 2011 and 2014, which was prepared in 2011 by the State Planning Commission, he said that by 2014, at least 80% of Ekiti people will have access to safe water. And to ensure that is extending pipelines into all those communities, is improving our dams, is constructing boreholes. For instance, in some local governments where the MDG office is intervening at the moment, we have about 124 boreholes, that have been constructed so that children have access. It's not just that they have schools, but they also have access to facility. And also ensuring environmental sustainability means that we have toilets and we discourage open defecation. Because when you look at open defecation, there are so many disadvantages. That's why we are also constructing public toilets, VIP latrines in primary schools. SUBEB is also constructing such latrines. The Ministry of Environment is also. So there are different layers of intervention in MDG to ensure the achievement of MDG 7, which seeks to ensure environmental sustainability. And so we are going to meet our target of the target of provision of safe water to Ekiti people. It's going on all around the state. We have so many kilometers. We have, I think, about 200 something kilometers that we just covered in the last phase of the MDG pipeline extension. We have water reservoir that the government has constructed in Ogotun, Ipole, Loro, Ilupeju, to replace the old ones, and even in Ogotun and Ipole, these are new reservoirs to take care of the people. Our government has constructed water treatment plants in Okemesi, Idoile, Efon, Erichinyo, and Ipole, Loro, all in the bid to ensure that we don't only rely on our dams. There are streams that we can use, use and reticulate the people, so that we have access to safe water. And when you also look at the tourism component of Mr. Governor's agenda, it's also to ensure environmental sustainability. In addition to generating income, in addition to providing employment, in addition to making recreation facilities available, in addition to placing Ekiti on that world map of tourism, it's also about sustaining that site. It's also ensuring that the environment is such that it's not degraded. There has been improvement on the environment. And when you also look at some other tourist sites, you will see that, when we are talking about environmental sustainability, because Ekiti is not a very large state, it is easy for a government with a vision, a government that knows what it's doing, to reach out and look at the various components all the things that need to be done to ensure environmental sustainability. I know that we will all recall what happened in Kogi State last year when Lokoja was flooded, and then we already had information that there are states that are prone to flooding that year, and Ekiti was listed as one of the states prone to flooding last year. But we didn't have the kind of flood that people expected, that we will have, because government had put in the mechanism for preventing flooding in Ekiti State. So the interventions continue. It's an ongoing process. There is no one-off intervention in Governor Fayemi's administration. Whatever is started would be continued and will be improved upon.
Ekiti State, she argues, has never had it so good. On whether the Ekiti State government's 8-point agenda can deliver on the MDGs by 2015, Mrs. Bumidipo Salami gives kudos to the Dr. Kadi Fayemi-led government with respect to its visionary delivery of quality governance being deployed through the 8-point agenda.
The MDGs is like the mother of the 8-point agenda, based on Dr. Fayemi's experience, his work before he became governor. The realization that meeting all these goals will mean that the lives of the people will be better, and for him not to leave Ekiti the way he met Ekiti. That's why that's been done. That's why the agenda was constructed. That's why all efforts are geared towards meeting the MDGs in Ekiti. When you look at the goal 3, gender equality and women empowerment, Ekiti is the only state in Nigeria that has domesticated the national gender policy. The only state that has deemed it fit to say this will make women's lives easy. This will bring dignity to women, will restore dignity to Ekiti women. Ekiti is the only state where we have the gender-based violence prohibition law. We have, I think Lagos and Enugu, they have domestic violence law. But this is a law that protects men and women in both private and public spaces. So it's not that violence is a domestic issue. It transcends the home, which means that a woman cannot be sexually assaulted in the public, it is not acceptable. It means that employers or senior officials cannot sexually harass women. There is a law that covers them. The women, girl children, men, and boy children. So when you look at all that's been done in the last, and that has been achieved in the last almost 3 years now, you see that it takes vision to be able to make linkages. When you have a vision and you share with the people, this is where I'm going, and then you match the vision with action, this is where we are going, and this is how I think we can get there, which is what Dr. Fayemi has doing and he continues to do for Ekiti people.
Thank you for watching Transformation 360 Degrees. We hope you have been more enlightened about Ekiti MDG's office. We do hope you'll keep a date with us next time. Ekiti MDG's office is the Southwest Regional Office of Nigeria's Millennium Development Goals. You can contact us at First Floor, Mutual House, Okesha Road by Governor's Office, Ado Ekiti, or email us at mdgs@ekitistate.gov.ng, or our Facebook page, Ekiti MDG's Office, or our Twitter handle at Ekiti MDG's Office. You can also visit our website www.ekitimdgs/ekitistate.gov.ng.